Thanks so much, everyone. My name is Gage Woolley. I work for the University of Cincinnati Alumni Association, but also the College of Nursing to plan these awesome events with our great faculty, staff, and alumni. So today, we're really excited to present strategies for nursing resilience amid a global pandemic presented by Tyson and Sue Brammer. There's some of our amazing faculty and staff over at the College of Nursing. So we're really pumped for to have them. They're some of our most well-rated staff, and I think people love them a lot. So we're really looking forward to having them. And Lee, I'm going to turn over the floor to you.
Okay, thank you very much. Good afternoon, everyone. I just want to first of all make sure that everyone can hear me, and to the degree that it's relevant, can you see me okay as well? Gage, if you can give me some verbal feedback there.
Yes.
Okay, excellent. Well, again, good afternoon, and to piggyback on what Gage, welcome to this version of the College of Nursing's webinar series, in this case called Strategies for Nursing Resilience Amidst the Global Pandemic. It is a privilege to be here. I want to thank you, Gage, for setting this up and for the invitation. The fact is that this is the UC Nurses Alumni Association. So what's really cool is that not only are we all nurses, but we are all UC nurses. And so in a way, I feel like I am amongst friends, and I feel like I am really amongst my own UC Bearcat family. A few things about myself to the degree that it might perk your interest. First of all, again, my name is Lee Tyson. I don't have any conflicts of interest to declare for this presentation. As far as my professional involvement goes, I wear a number of different hats. First and foremost, I am an associate professor of clinical nursing at the College of Nursing, and I have the privilege of serving as the director of the psychiatric mental health nurse practitioner program. So we have a postmaster's certificate program for PMHNPs, and we also have a BSN to DNP and a post-MSN DNP program, clinical track specialty in psychiatry. I also am the founder and owner and CEO of a growing privately held psychiatric practice called Leaside Wellness in the tri-state area. And a final hat that I wear professionally is I am an inpatient psychiatric hospitalist at a facility in Dayton. So again, good to be here with you folks. Dr. Brammer, tell us a little bit about who you are.
Thank you, Dr. Tyson. Let me get my picture, and I look nothing like my picture now. I have glasses, I'm older, my hair's short. So I like my picture better than my current status. But I am an associate professor of nursing education, and I teach in Dr. Tyson's program. And I also am working on some grants. I'm a principal investigator in a grant that uses virtual reality to train Medicaid providers about social determinants of health. So that is my world for right now.
Excellent. Thank you, Dr. Brammer. Well, we are going, in order to get things started, but let's talk a little bit about a working definition of resilience. And we'll just sort of start out in layman's terms. And I say layman's terms, but we're going to start out actually with Merriam-Webster's dictionary. So Webster defines resilience in its generic form as just the capacity to recover, and I like this word, quickly from difficulties. And another word that it uses here is toughness. In other words, it's that robustness, it's that grit, it's that durability, it's that sense of hardiness that we're referencing when we talk about resilience in general. And then another portion of the slide comes from Psychology Today website, and it defines resilience in a little bit more nuanced fashion. And it says it's the psychological quality that allows some people, I guess not everyone, but some people to be knocked down by the adversities of life and then come back, I like this part, at least as strong as they were before. And so rather than letting difficulties and traumatic events or failures overcome us and drain our resolve, this definition really does just suggest that highly resilient people somehow find a way to change the course, to emotionally heal, and then just to continue moving toward our goals. And then as we move to the next slide and we take a look at, well, what do we mean when we talk about specifically nursing resilience? Well, according to Kim et al., who recently, in fact, earlier this year in 2022, as a matter of fact, so this is a real fresh off the print definition, they compiled a meta-synthesis on nursing resilience, and they define nursing resilience as the nurse's ability to adapt positively to stress and adversity. So stress and adversity is going to happen, but it's our ability to adapt positively to that stress and adversity. And they also said that it involves a complex and dynamic process that changes over time. So it's fluid, and according to the situation, embodying not only personal attributes, but also our external resources. And then we look at Van Breda, who in 2018 said that nursing resilience is the multi-level processes engaged in to obtain better than expected outcomes in the face or wake of adversity. And again, I like that part too, because it says we're going to get better than expected outcomes when we have adversity. So what I get from these definitions is that not only is resilience that toughness, that grit, that determination, that tenacity, but it is a complicated, it is a learned process that happens over a period of time. And also, not only is resilience about the process of us learning how to better cope, but the quality of one's resilience is determined by having those better than expected outcomes. Dr. Brammer.
So why is, oh, let me see. So why is resilience important? And I'm going to try to pull my lovely face up here. Am I showing?
Yes, you are.
Okay. So why are we even talking about resilience? Well, the media is full of accounts of the bad news about nurses' health, especially during the pandemic. We hear about nurses who are just burned out. They're coming down with COVID. They are ill. Their rates of depression and anxiety and substance use disorders are going up. And it's true that many are suffering. There was a study out by the University of Michigan that had really alarming results. And these authors looked at the rates of suicide of nurses between 2007 and 2018. And the rate of suicide of nurses was twice that of the general public, twice. And even more alarming was that female nurses died at a suicide rate that was 70% higher than female physicians, 70% higher. And so, yes, many nurses are suffering, but many are able to be resilient. And so we want to tap into that. We want to talk about that, not just the suffering, but the resilience. And so when we can, again, tap into this resilience, we see that nurses are protected against PTSD, against depression, against anxiety. And so nurses who are resilient also have increased job satisfaction. We don't dread going into work every day because we're more satisfied with our jobs. A 2018 survey found that over 50,000 nurses in the US found that about 1/3 of nurses who left their current jobs felt so, they did so because of burnout. That was a significant factor. And 43% did so because, or felt that they were going to leave their jobs, and burnout was a significant factor. However, there's other studies that found that resilience negatively correlated with intention to leave their jobs. So it makes a difference with resilient. Dr. Tyson is going to talk more about burnout and compassion fatigue in a little bit, but burnout is defined as erosion with one's job, with engagement with one's job, and it usually happens gradually over time. Compassion fatigue has to do with not being able to cope with the suffering of other people. And this is long-term exposure to the suffering of other people. So resilience lessens the chance of this happening, of experiencing burnout and compassion fatigue. And when you're burned out, you suffer physically, suffer emotionally, mentally, spiritually. And I read a description of compassion fatigue, and it said, it was a deeper fatigue which seemed to lie in the soul. It weighed upon my soul. And this was a fatigue that didn't get relieved by sleep. It was just this holistic, it sapped everything that I had type of fatigue. But resilience protects you against that. You don't experience it when you're resilient. So it increased your happiness and well-being. But not only does resilience benefit the nurse, it benefits patients. There's data to show where burnout and compassion fatigue actually cause a negative impact on patient outcomes. There's data to show where infection rates, hospital-acquired infection rates go up and fall rates go up. Just patient care suffers. But fortunately, there are studies that show that with resilient nurses, patient care actually improves. There was a study by Vector and Zahari where nurses were first classified as low resilience or high resilience. Then they were observed filling out the Morse fall scale. And then they were interviewed about how they filled it out in their practices working with fall risk patients. And what was found was that high resilience nurses didn't take the scores at face value. They thought in terms of kind of worst case scenario based on hunches that they had about the patients. They thought of just hunches, kind of a sixth sense of what might happen with these patients based on their assessment. So they assessed them more frequently. They educated patients. And sometimes they even padded the scores a little bit so nurses would check them more frequently. On the other hand, the low resilient nurses took the scores at face value. They just followed protocol because they felt that they had no control, that patients were unpredictable and there wasn't really anything you can do about it. And they were more likely to deal with that unpredictability by restricting patients' movements, by restraining patients. So I thought that was pretty impressive. There was another study that had physicians and nurses who had higher empathy or compassion and low burnout, which we know is related to resilience. So physicians and nurses who had higher empathy and lower burnout demonstrated better blood pressure control in their patients, both patients without high blood pressure and patients with high blood pressure. And finally, we connect and engage better with patients. When we're burned out, when we have compassion fatigue, we avoid patients. We're cynical. Sometimes we even get irritable and we get angry with patients. So resilience keeps us engaged and connected. And so now Dr. Tyson is going to talk about some barriers to resilience.
Great, thank you, Dr. Brammer. So anytime there's something good, it seems in life, at least I notice this anecdotally, anytime there's something good, there's always barriers to get to that good thing, right? And so I think we all agree that, you know, having resilience in professional nursing is a very important thing. So what are some of the things that inhibit that quality? Well, here are just a few of the many, and there could be, this is not an exhaustive list at all, but here are just a few of the ones that I want to touch upon. The first is this, it's what I call anyway, the perception of perpetuity. And I put perpetuity there because I thought that would sound a little bit more academic, but really that is a word that just means permanence, right? And in other words, nurses are not likely to be very resilient if we have an attitude that says this bad thing that has happened to me or is happening to me, man, it's just gonna last forever. But unfortunately, in the midst of this pandemic, that is exactly the type of thinking that has been incredibly topical during COVID-19. We hear it, you hear it in your settings, I'm sure all the time, words and phrases like this. This is just how we're gonna have to live from now on, or I'll never be able to go back to work, or it's never gonna be able, things are ever gonna be the way they once were. And while you and I as nurses know that nothing lasts forever, this type of dramatization of events, they reflect our fear in those events, okay? And so we, I think, are gonna find ourselves in trouble in trying to achieve resilience if we find ourselves saying or thinking things like, things like this, like, I'm gonna be stuck here forever. I'm never gonna have enough money. I'm never gonna get all the experience that I need to apply for that job. Yet you and I both know, and I realize I'm preaching to the choir here, the moment we use the word never is the moment that we give up. Resilient people accept where we are, but we also understand and recognize that we're not going to be in that place forever. We learn to challenge the perception of permanence or perpetuity, all right? A second barrier to nursing resilience is incongruence. And what I mean here is really just, and Dr. Brammer already alluded to this a little bit, what I mean here is a lack of work-life balance. And so when we as nurses find ourselves missing family events, constantly working overtime, constantly picking up that extra shift, filling in, trying to be helpful to other people, filling in free time with work, having a social life that is more or less on life support, when those things become increasingly self-evident in our lives, or when other people recognize them in us and our behaviors, there is a general sense of life work incongruence. And that, according to the literature, is inversely correlated with nursing resilience. Another barrier is vocational despair. And what I mean by that is just having an unsupportive job, being in a professional environment that is not conducive to your own wellness. Because I think this one is fairly self-evident, I will spare me going into a deep dive here, but just know, folks, that when we don't feel supported on the job, and when leadership, when they don't have our backs, and when nurses are, and this recently happened, you all are aware of this, when nurses are convicted of things like negligent homicide because they made a simple medication error, and now many nurses are thinking about leaving the profession altogether. Well, we may be experiencing vocational despair. And vocational despair, as I've already iterated, it greatly inhibits nursing resilience. A fourth barrier that I want to touch upon is globalization. And what I mean here is this is something that involves us drawing universal negative conclusions about things that we're going through, about our circumstances and situation. And so really this
Did we lose you there, Lee? Yeah, I think we might have lost you, Lee, there. Would you be able to hop in, Sue, until he jumps back on?
Sure. Sure.
Thank you.
Move on. I'm going to try to move on. It might have been my computer, Gage. No, there we go. Okay, I'm going to move on to characteristics of the resilient nurse. So Dr. Tyson was talking about barriers to resilience. So I'm going to talk a little bit about what resilient nurses look like. One characteristic or one feature is education level. There has been some kind of conflicting research on this, but there have been studies that resilient nurses tend to have higher degrees, like master's and doctoral levels. Now, before people get offended, this does not mean that resilient nurses, you have to be, that they're more intelligent, that you have to have an advanced degree, and that you're more intelligent. That's not what it means at all. It means that if you have a higher degree, you are more likely to be autonomous in your job. You have more autonomy, and so you have more control. And when you have more control in your job, you usually have more job satisfaction. So that's what that is about. Now, one author did say that with enhanced education, you have, quote, more planful problem-solving skills, but I'll just leave it at that author's opinion. But it's really more about autonomy in the role. So then there's reflective. Resilient nurses tend to be more reflective. And what do I mean by that? There's Dr. Tyson referred earlier to Kim and Chang, who did a meta review. So they looked at tons of studies about resilient nurses and the characteristics of resilient nurses. And they found that resilient nurses really take a look inside themselves at adversity and problems, and they reflect on it. And they focus on the present. They don't think about what has happened. They're not looking too far into the future. They're really paying attention to what is going on with me now. What's going on here? And they accept the situation for what it is. They express their feelings honestly, and they acknowledge and accept signs of adversity. They're on the lookout for it rather than, and they don't avoid them. They just kind of accept them in the present and for what they are. It's adversity and what it feels like. I feel stressed. I have a headache. I feel down. they don't try to avoid it. They kind of take it as it is, but they also demonstrate self-efficacy, and they have self-confidence that they can get out of that situation. They can use problem-solving skills, and they can get out of those feelings, out of that problem that caused that adversity or stress in the first place. Those are resilient nurses. They use flexible thinking to solve problems. It's not a matter of there's only one way to do this. They're flexible. Resilient nurses are optimistic. Dr. Tyson kind of alluded to this. Resilient nurses aren't glass half empty. They're glass half full. And they look at every situation, even when it's a bad situation, even if it does not turn out well, even if they fail at something, as an opportunity to learn and grow. And they live life with gratitude. They're appreciative of what they have in their lives. Resilient nurses can maintain a sense of humor. That includes at work. How many nurses do you know that don't have a sense of humor and they are a drag to work with? We don't like to work with them. And very often they're the ones that get so stressed out because they can't stop and laugh about something. We have to be able to find humor in some situations. We're not laughing at people's distress, but we can find humor sometimes in our own behavior and something funny about our own distress, if you will. Resilient people can remember good things from the past too. Even when there's pain, they can still remember some good things that happened from the past. They live a life of helping others, and we're in the profession to do that. They find joy and pride in what they do. Resilient nurses, and I took this term from a study that looked at them, and were tenacious. Resilient nurses are tenacious. And some other other synonyms for tenacious are not very flattering, like obstinate, stubborn, but really tenacious is persistent, dogged, resolute. Tenacious nurses, resilient nurses are like bulldogs. They don't let go of a problem until it gets solved. And that's resilience. Their work has meaning. There's a quote, "When people feel to have failed, being insignificant and making no difference, they start to feel helpless, hopeless, and they crash." And that's from an author named Companji. And that's what happens in burnout. Resilient nurses remind themselves that their work has meaning and that what they do does make a difference. They gain satisfaction from their work and they see a project through to completion. They have a sense of professional pride and they value being a nurse. Resilient nurses are very proud of being a nurse. I talked earlier about being satisfied with their career, and they have a passion to work. There's a passion about being a nurse, a passion about whatever specialty they're in. And they want to keep developing their knowledge and skills. Even if you've been a nurse for 24 years or 25 years, there are still things to learn. Work-life balance. Dr. Tyson talked about that. Well, resilient nurses know where to draw the line with work. They know when to say no. And they enjoy life through leisure activities. They have hobbies. They have good relationships, interpersonal relationships. They get comfort from friends. They get help from family members. They maintain good relationships with colleagues. Resilient nurses also know when to get professional help. and they get it. They don't shy away from it. They use positive coping strategies. Dr. Tyson is going to talk about those next and what to use for positive coping strategies. But, you know, they get enough sleep and exercise. They eat healthy diets. They share their feelings with someone else. But there was one study where resilient nurses talked about mental preparation strategies that they use before they start their shift. And one strategy was wearing perfume or fragrance deodorant. And what they did this because it helped them, it boosted their self-confidence and kind of got them ready to face the world when they wore a pleasant scent, kind of energized them. Another was drinking coffee. Now, it didn't say how much coffee, and too much of a good thing, I guess, would make you nervous, but it did boost them a little bit. One was listening to music on the way in, and that gave them some energy. Now, this dates me, but my song was always, "You Can't Always Get What You Want" by the Rolling Stones. And I realize that dates me, but that was always my pump me up song. That really got me going. But the most frequently mentioned one and the most important one was socializing with colleagues before their shift started. And think about it, when you get to work, how much it really kind of boosted your spirits to be able to just chat with your buddies about what you did for the weekend. And that was very important to them. And I'm going to mention one more thing before Dr. Tyson hops back in with his with the last part of his talk. And one is well-developed empathy skills. And I didn't just say empathy, and it's not on your slide, but there's two types of empathy. There's cognitive empathy and affective empathy. And affective empathy is sharing emotions, and we do that automatically. And some of that is necessary. We kind of feel another's pain, and we do that, and that helps us be concerned. But if we do too much of that, or for too long of a time, we really get distressed and we share another's distress. Then cognitive empathy should kick in. And that's where it's perspective taking. And we regulate our emotions when we start to feel this prolonged distress. It's the capacity to understand another's internal state. Again, it's this perspective taking. And when we can manage and control our emotions so we don't become so distressed, that's what resilient nurses do. Okay, Dr. Tyson, I'm going to hand it back over to you. Do you
All right, and I hope that my computer doesn't freeze this time. I am so sorry. I was just yammering away, and then I realized I don't think anybody's with me, and so my apologies. So Sue, where did I lose you guys at? I am so sorry. I know we were on barriers. I know we were on this slide. The previous slide is when I realized there was an issue. Did you go over the second slide, Sue, or did you just kind of move on?
No, you were just finishing globalization.
Okay, great. That's when I noticed it so very well. So I will quickly kind of go back over some of the other barriers, if that's okay with you all.
You want to start with compassion fatigue?
So compassion fatigue, I know that Dr. Brammer, you've already spoken about that a little bit. So nurses, you guys know this already. So often we have prolonged exposure to other people's trauma. And that is really compassion fatigue, or can set us up for compassion fatigue. Other words for compassion fatigue is secondary trauma or vicarious trauma, which is not a good thing, and is certainly a barrier to being resilient nurses. And there is a difference, as Dr. Brammer alluded to, between burnout and compassion fatigue. It really has to do with more of a spiritual, soulful component, negative spiritual experience when one has compassion fatigue. There's almost a part of you that feels like you're not a very good person anymore, because you don't have the energy or even the desire within your soul to be able to offer care to other people. And then there's social isolation. And this kind of goes without saying, but we as nurses, we need others. We don't just need other nurses, but we need other people in general. We cannot survive, and we certainly cannot thrive alone. We need each other, we need support, we need encouragement, we need people to have our back, we need grace. And where do we get those things which help foster resilience is through other people. And I'm just going to lump a few final barriers together here because of time, budgeting purposes. But how about these? Overexposure to stressful events. And now, again, I know that ties in closely to what I just mentioned about compassion, fatigue, but just having one stressful event after the next. And that's what we as nurses face so consistently, it seems. And then, when negative things happen to us, when we have those stressful events, having an insufficient amount of time and space to be able to process those negative feelings. And so having kind of, forgive my lack of professionalism here, having crap rain down on us and then not having the luxury of having time to be able to filter and to process and to put in their proper places and to compartmentalize as we need to those negative feelings. And then, nurses, let's be honest, we're not at the top of the pecking order, and there is an order of hierarchy, in the medical and nursing worlds, and we are not at the top of that. And so as a result of that, sometimes we have humiliating experiences, not just horizontally in our patient relationship or our peer relationships, but sometimes physicians might humiliate us. And that can make us question ourselves and beat up our confidence, all of which can culminate into serving as barriers to resilience. All right. Now, Sue, if you don't mind, let's jump on ahead to some strategies to becoming resilient in nurses. This is the heart of what we want to say today. And so the first thing I want to share is we've got to have healthy boundaries. Okay, we preach this to our patients. We preach this if we're moms and dads to our children and grandchildren. When you think about it, boundaries are just rules and limits that we set for ourselves and others, right? And what boundaries do is they communicate to others and to ourselves acceptable ways of interacting with us. Think of boundaries kind of like a no trespassing sign on a property line. That is, there's a clear sign that once you cross a given boundary, a given line, there will be consequences. Now, while a no trespassing sign for a property line is easy to understand, it's easy to see, creating our own personal boundaries is a little bit more challenging than that. And that's because each of our own personal boundaries, they're different, they're unique, they're invisible, they're not always spoken, they're not always well defined, and they are fluid across the board. Yet, even though setting boundaries in our lives can be incredibly challenging and incredibly frustrating, boundaries, they really are an important thing to do in order to establish. They're important to establish because they ultimately define where you end and where others begin. And then I want to talk a little bit about self-care. We've had boundaries, having good, healthy boundaries as a strategy to become resilient nurses, and then there's self-care. And I know when I say some of these things to you all, it's going to be preaching to the choir. It goes without saying that we as nurses, we all know what we need to do cerebrally, intellectually in order to maintain good health. However, we as nurses are very poor patients in general, aren't we? Because we're always trying to take care of other people, not just in the professional arena, but in the personal arena. It kind of comes down to that metaphor of like when the oxygen mask pops down out of the ceiling, and we all panic when we're on an airplane. And what are we supposed to do? We're supposed to put the oxygen mask on others first, right? No, on ourselves, so we can properly take care of others. But we have this tendency to put the oxygen mask on other people first. And we sometimes forget to put it on ourselves altogether. And my question is, how long can we neglect our own self-care before it really begins to show? Society says again and again and again that we as nurses, we are the #1 trusted profession out there. We are viewed as the heroes in healthcare, and we're viewed as the experts in health and wellness. So how can we be considered good role models when we're neglecting our own health? Self-care is key to developing nursing resilience. And folks, it is critically important to practice self-care both in and out of the workplace. And then let's look at coping. Coping is another strategy to becoming resilient. Conventional wisdom tells us that negative experiences are just going to happen. They're just a part of life. Things in life just don't always go the way that we want them to. Life doesn't always turn out the way that we had planned. And so the question is not if you and I are going to go through hardships at one point or another in our lives, but rather when we go through those hardships, how are we going to handle them? Coping mechanisms help, and they are skills that help make us make sense of the negative experiences that happen to us. It's kind of like when life gives us lemons, our coping skills help us to, transform that as an opportunity to making lemonade. But the problem is, without having effective coping mechanisms, we can turn into the lemon ourselves by misinterpreting things to really be a reflection of our own inadequacy. But healthy coping helps us translate fear into a calm confidence and an inner peace, right? So coping is so important. And then there's relationships or socialization. I could have easily put that word there as well. Socialization can provide so many benefits to our health and to our resilience. You know what the #1 protective factor against mental illness is? It's not Prozac, it's not medication, it's not therapy, it's relationships. It's having those horizontal relationships, those people to undergird and support us and to, let us ride on their shoulders sometimes. And do you know, likewise, what the #1 contributor to longevity, to having a long life, to maybe even being a centenarian is? It's relationships. It's not just genetics. It's not just taking care of yourself, but it's having those human supports, those cheerleaders in your life, those people who have your back. That is the biggest contributor to a long life. And it's a big contributor to becoming a resilient nurse as well. Then the next slide, let's talk about confidence a little bit. Confidence is so critically important in developing resilience. In essence, confidence in layman's terms is basically a strong belief in yourself. And maybe even, we don't even need that word strong, just having some belief in yourself. It's the conviction that you and I have the ability to meet the challenges of life and to figure out a way how to succeed. It helps people gain credibility. It helps us to exude a strong first impression on other people, on our patients, on our peers, and it also helps us to deal with pressure and to tackle the challenges that we face as nurses. And furthermore, it's a really attractive character trait because confidence helps put other people at ease. And not only does it help put you at ease, it also is going, and others at ease, it's going to help us to become more resilient. And the last thing I want to say about confidence is that this is not something you either have it or you don't have it. It's not some innate, fixed characteristic. It is an ability that can be improved, acquired and improved over time. So it's important to resilience, and it's something that you can work on and you can develop, even if you feel like you don't have that particular characteristic as a part of your arsenal in professional nursing right now. Another strategy is what I call existential identity. And basically, what I mean here is purpose. This has a little bit to do with spirituality. When we talk about spirituality in nursing, we're not talking about religiosity, whether you're United Methodist or Baptist or Islamic, you're a Muslim. We're talking about, do you have a reason to get up and to get out of bed in the morning? What is it that helps you to keep going? That is spirituality. And that is having a strong sense of existential identity. And when you don't have a strong sense of purpose or existential identity, you're not going to be as resilient as you otherwise potentially could be. Rick Warren, some of you guys have maybe read his book that he wrote in the 90s. He first wrote a book called The Purpose-Driven Church, and then he wrote a subsequent book called The Purpose-Driven Life. And it took its place kind of like of almost biblical proportions, to like in the self-help books. And the reason it was so successful is not because he was touting, God. He really wasn't. He was touting everybody needs a reason to get up out of bed every morning. We need a sense of purpose. And so we as nurses do as well. All right. And then let's talk about a locus of control. What is a locus of control? Well, a locus of control really refers to the degree to which a person, a nurse in our case, feels a sense of partnership or feels a sense of agency or intervention in our own lives. So for example, someone who has a strong internal locus of control tends to believe that it is the decisions that we make, our choices, our behaviors that have a high sense of impact on outcomes and on our fate, okay? And so research tells us that having a strong internal locus of control yields resilience. What is external locus of control? Well, people who have a strong external locus of control feels that other forces or other people, their choices, their behaviors, their actions, circumstances that we have no control over are ultimately more responsible for our fate. And so research demonstrates that those of us who have a strong internal locus of control are ultimately more successful, healthier, happier, and more resilient than those with a stronger external locus perspective. And then let me just talk a little bit about integrity. Integrity is a word that we throw around a lot. These days, we don't ever really talk about what it means so much, but it seems to be a hot topic of the day. In layman's terms, probably the best, most frequently working definition of integrity is doing the right thing even when no one else is looking, right? And so we all want to be people of integrity because it is really the antidote to self-interest. It is one of the characteristics that prevents us from being selfish human beings. Here's the good news about integrity, because I question my own sometimes. The good news about integrity is that we're not born with it, and we're not born without it, which means that it is a behavior-based virtue that can be cultivated over time. And so you can improve your integrity, right? You can develop integrity. It's not something that's binary. You either have it or you don't, but it's something that can incrementally be improved and developed in our lives. And it is another key to becoming a resilient nurse. And finally, let me throw in one that's not on the screen here. And I think this will make sense to you. Failure. I didn't have time to ask Sue to add in another strategy, but what about failure? To fail is deeply human. Every single one of us fails probably almost every single day if we really want to be nitpicky. No matter our background, our life story, we are going to spectacularly fail on at least 2 or 3 occasions in our lives, right? No matter who we are. But here's the key: learning to be okay with making mistakes, whether they're big mistakes or small mistakes. That is a critical skill, one tied not only to resilience, but also to our future success and to positive outcomes, I think, as nurses for our patients. One recent study, and I'll conclude here, one recent study found that young scientists who experienced a significant setback in the very early stages of their career actually went on to significantly greater success than scientists who all they had in the beginning stages of their career were early wins. Okay, so even the failures in our life, and perhaps even especially the failures of our life, can be a strategy to developing resilience. Dr. Brammer.
I'd like to conclude here with a quote. Although the world is full of suffering, it is also full of the overcoming of it. And this quote is from a book written by Helen Keller called Optimism. And I like it because it takes us back to where I started in my part of the presentation when I asked, why are we talking about resilience? Why is it important? And there is a lot of suffering in nursing, and I don't want to minimize that. But there's a lot of resilience going on too. And so we should be identifying it, celebrating it, and cultivating it in ourselves and helping other people cultivate it too. So thank you very much for attending today. And if you have any questions, we would love to hear them.
You can also type them into the chat box if that's a little easier, depending on where you're taking the webinar from.
Hi, Doctors Tyson and Brammer. This is Carolyn Smith. Awesome presentation. Really helps me to step back and think about, as an educator as well as researcher, what are things that we need to be building into our students in terms of helping to increase their resilience. I was wondering if you could speak a little bit about what maybe we can be doing for undergraduate students that are going into nursing to be able to build into them some skills and resources so that once they get into the profession of nursing, they have some of that knowledge to fall on.
Dr. Smith, I'll just say here, thank you for your question, and thank you for being a part of this today. I don't have a like a nice, clean, wrap it up in a package and put a bow on it answer to your question, but I would say the naive idealist that I tend to be. I know it's not practical, but oh my goodness, how wonderful would it be if in your program, in the undergraduate program, every student, every nursing student could have like a mentor. And maybe you already have something like that, but somebody who could just be there, a support person to bounce things off, because resilience, it's hard to define. It's hard to like just teach. And I think really resilience is something that needs to be coached. There's a big thing in behavioral sciences today I should say a new career that's budding called life coaches. And I find myself in practicing psychiatry more and more, or sending patients not just to psychotherapy, but to have a life coach. And those life coaches, they teach people these kinds of things. So my wish for you and your students and your program would be that everyone would have a life coach, everyone would be assigned a mentor, if only there were enough of you guys to make that happen, right?
I think that talk about work-life balance, we can talk about school-life balance, and talk about with students how to recognize stress and when they're getting into and giving them resources for dealing with it. Teaching them to be more reflective. Like I talked about resilient nurses being reflective, recognizing again when those kind of listening to themselves not avoiding of adversity, not avoiding when they may be getting into trouble. And again, providing them with resources. That would be my thought. And I guess one more is that when, you know, they do badly on something, maybe coaching on what can they learn from it, because they're going to fail at things, whether it's failing at a test, messing up at a clinical simulation exercise. And so it's not the end of the world. What can they learn from it?
And it's to piggyback on what you just said, Sue, it's teaching them when they fail, it's coaching them to fail forward and to fall into, to lean into their failure and not to be afraid of it, but to embrace it and that it's okay. Any other questions or comments? I think, Gage, I don't seem to be able to see any typed responses, but if you can raise any to Sue and I that we should answer.
I don't see any questions in there, just lots of thank yous from everyone so far, but let's take a look. Yeah, just a lot of thank yous so far. So.
And happy Nurses Week to all of you. So really key week, privileged week for Sue and I to be able to offer this presentation. So, and you know, and as you guys know this, you've all done presentations, I'm sure, like this. You know, we as the facilitators here, we learn just as much, if not more than you do in putting together this stuff. And so it's been good for us as well.
Yes, thank you.
Great. Well, there are no other questions, and it doesn't look like there. I appreciate everyone for taking their time today to come listen to Lee and Sue present this important topic. So really means a lot to have both Sue and Lee do this because they are so integral to the college. So once again, thank you both.